When you hear that you have to have surgery, what does that mean and who's doing it? General surgeons. And we're going to learn more about what they do and how the whole process works. Joining me today, Dr. Edgerton. She's a general surgeon at Mercy Health St. Rita's. And thanks for coming today, doctor.
Thanks for having me.
Okay, so when we hear general surgery, what does that mean? I mean, a general surgeon, what do you do?
So it's kind of a big question. General surgeons do a lot of things, kind of the whole body. So starts anywhere from skin and soft tissue, gallbladder or the biliary system, breast, both benign as well as cancerous, the bowel, colon cancer, benign colon diseases. And then we see a lot of hernias as well.
Oh, all right. So some of those surgeries, are there things that we can do? Are there signs that we know maybe surgery can be avoided, or for some of these things that just has to have a surgery?
Yeah. So there's always things to look for. So for example, for like a hernia, oftentimes you'll notice on your abdomen or in your groin a bulge that can oftentimes be painful. It's good to get that looked at sooner than later. As with time, as it gets bigger, things can get entrapped in there. You can get your bowel that can be stuck, and then it becomes emergent. So if we can get these taken care of before we get to emergency, the outcomes are better, the risk of reoccurrence is lower, and so the goal is to get those taken care of as soon as we can notice them.
Right, yeah. So you don't want emergency surgery. You want to have it set up and know what's happening ahead of time. Yeah, okay. All right, but anytime someone hears the word surgery, I'm sure you guys see your team that people are afraid. So what kind of things do you do as a team to help people and their families?
Yeah, I think when it comes to surgery, the thing people are afraid of is the unknown, right? What's going to happen? What are we doing? And really, why are we doing this? And so if before surgery we can talk to patients, talk to their family, kind of go over the anatomy and let them understand what's happening, how we're going to fix it, all of the risks, all of the benefits, and then what to expect after surgery. I think knowing those things makes people a lot more comfortable.
Right, yeah. So when it comes to surgery, what kind of changes and things have you seen through the years that, makes it easier on you and maybe even the patients too?
Yep, so robotics, although it's not new, it continues to evolve. We get new machines that kind of helps give articulation, so we're able to manipulate and dissect tissues out more safely. Robotic systems allow us to do surgeries with smaller incisions, quicker recovery. Also, there's developments all the time in products that allow us to kind of decrease complications, products that help prevent leaks, or what we call anastomotic leaks, where we put the bowel back together, between sealants, between amniotic cell tissue. These help us give better outcomes to patients.
Wow. Is it kind of amazing how new things happen all the time?
Yeah, things are always evolving, and it's always directed to give the best care to the patient.
Right, yeah. All right. Well, thank you very much for coming today. Tell us a little bit about surgery and what's happening in our area. So thanks.
Thanks for having me.
All right, don't go away. Noon Edition will continue in a moment.